So if you've had a C-section, a total hysterectomy, or any other kind of abdominal surgery that has caused a scar or even those small portal sites at your abdominal region, then we know how many surgeons will not explain the process of how to really get that area to heal effectively and not cause you pain in doing so under that abdominal region. Now, keep watching this video. If this sounds like you've had a surgery, even if it's been months or years, and it's hard to feel like you're doing abdominal exercises correctly. It just feels like something's not quite right, or you're having any numbness or uncomfortable feeling at the area underneath a scar. Now, you always want to wait at least 10 days or until you've already had your post-op appointment with your doctor so they can clear you for any kind of infection. If you see redness, swelling, anything like that, you don't want to be doing these techniques. So I just wanted to mention that. Make sure your doctor has cleared you and that incision has healed. And the techniques I'm going to talk about today, keep watching this video, because they're going to help you ease any pain or discomfort you have around the scar area. And when you start working out and exercising again, if that scar tissue is bound down and it's uncomfortable, in the muscles underneath won't be able to activate and be used as best as possible. So for many women, especially after a C-section or hysterectomy that we see, as a pelvic floor physical therapist, we treat these kind of people all the time that have had these kinds of surgeries. And in order to heal your body most effectively, those core muscles need to be accessed by not having a lot of adhesions or being bound down there on the fascia outside the muscle. So I'm going to show you how you can start working on doing some scar tissue mobility, what you need to do to help that area heal more effectively. And even if it's been a long time since your surgery, just know you can still make a change. You can still make improvements in scar tissue, and is going to help you be able to do more abdominal or core related exercises. So I drew on my hand here what that incision looks like. So just pretend this is across my abdominal area, and I'm going to start with a couple different ways first. So if you don't fully want to touch the scar yet, or it's still a little sensitive, you can go maybe just like an inch above or an inch below. And I'm going to start moving back and forth here. And this area is going to slide the skin and the fascia underneath back and forth. So you can come at your abdominal area kind of like a 45-degree angle. So if you see my fingers from the side, say my incision's down here, I'm right above it. And I'm just gonna give some small presses there and move that skin back and forth. So that's where I would start if it's still a new incision and this is brand new to you to work on any scar tissue mobilization. We're gonna do above and below that area. And you can do it for like 30 seconds, a minute, up to 2 minutes at a time. Change different areas that you are applying pressure to go along the scar above and below. So that is the first technique. The second one is we're actually going to start by touching where that scar is. And I'm going to put 2 fingers there, and I'm going to go in a circular motion. So you're right on the scar and you're putting a little bit of pressure there, not too hard, but just enough that you can get the skin and the incision moving. So I'm going to travel along that incision, and you may find an area that's a little more bound down or a little harder and doesn't move quite as easily. So that's where I pause, and this is what I do with my clients too, is I put a little more pressure there and do some circular motion and go along the full area of the incision. And you can stop in those areas that don't move quite as easily. So we have the second technique there I showed you is more of a circular motion. Then the third thing that you can try is going perpendicular to the scar. So now I'm actually on it again, just like the circular motion, but I'm gonna go back and forth, up and down there. And once again, I may stop at where I get a little more restriction there, or I feel like it's a little harder, and I'm gonna move that back and forth and stay there just a little bit longer. Now this can be done once or twice a day. It's something, like I mentioned, you wanna integrate once your doctor has cleared you and your incision is fully closed with clean hands and you have sanitized your hands too. So that's the third one. I'm gonna move perpendicular. Then the next one is you're actually gonna be taking it and pinching the skin and lifting it away a little bit too. Now, if it's really tender or you're afraid to touch that area, because I've worked with a lot of women that are afraid to touch the area, it can be related to just thinking about the trauma in the area too, and it can just exude some emotional response as well, and that is completely normal. It's good to go above and below and just kind of get used to it too, so you get the sensation there and you get comfortable with it before you start moving it. But that last technique that I showed, you're kind of pinching and lifting. And if it's hard to do that, you can actually try it in sitting too, maybe just get a little more slack on the tissue. So it'll cause a little pinching and a little lifting there. So that is how you can work on 4 different techniques with doing scar tissue massage or scar tissue mobility. This is something that is not usually explained by the doctor, but it's very important to do in order to get that area to heal. Now, I've seen women, it's been a long time since they had an abdominal incision, and they start having maybe some symptoms related to pelvic pain, back pain, hip pain, or even some bladder or bowel issues. So after a C-section or a hysterectomy, if you're experiencing any of those issues and you've had an incision here, that is something that we definitely want to go toward and start lifting that tissue and getting it more mobile, because that whole area is connected by fascia. If something is bound down here, it's going to affect your back and your hips and pelvis and all of that as well. So very important in your recovery and at any stage after a surgery. Now, once you've been working on the scar tissue mobility, another thing that's going to be very helpful after those 4 techniques is some breathing exercises. And I'm talking about doing some belly breathing, not breathing from the chest here, but breathing more from the rib cage and the lower abdominals. So you can try this nice and easy on your back. You can do it sitting up, but I'm gonna demonstrate here so you can see where my hands are. And if I'm on my back with my knees bent, I'm gonna place my hands on the lower belly. You're gonna think about inhaling, and you'll see the fingertips rise, and then exhaling, you're coming back in, so you'll see the belly rise and fall. And that also is going to work on stretching and creating more mobility in the scar tissue. So we call that diaphragmatic breathing or belly breathing. 2 different ways. You want to think about the ribs opening and closing from the side, and you want to think about raising and lowering the belly when you're taking some deep inhales through your nose and exhale through your mouth. So those can help right after you do the scar tissue mobility, because now it's going to be an exercise to reinforce that kind of stretching and pulling there on the incision. The breathing exercises are going to be safe to do even if you're newly after surgery, even before you've done your post-op checkup. But I would wait on the scar tissue mobility techniques with your fingers until you've been cleared by your doctor. So those are things that can help you be able to recover from the surgery effectively, have less pain, discomfort. That whole core area, the pelvis and the lower back and the lower abdominals are all affected after any kind of abdominal surgery. So it's very important that you not only work on the massage part, but work on some belly breathing and getting that tissue to kind of stretch and open up as well. Now, if you learned something from this video, if this is totally new to you and you didn't even think about doing scar tissue mobilization or massage like I instructed in this video, then please comment below and let me know. I know so many of the women that I see, we try different techniques where maybe we even use some cupping, we use some hands-on techniques, and even working on the fascia in the lower back. There's a lot of hands-on techniques that can also help you if you visit a practitioner in your area. But that can be simple things that you try at home and working on the breathing exercises. And you can go over to another video I have called diaphragmatic breathing that's going to talk you through that as well and how you can work on that effectively. So if you want to learn more about women's health topics, exercises, and techniques, just like I showed today, then I would invite you to hit subscribe to this channel and you'll get updated when we release new videos. Thank you so much for watching, and let us know if we can help you in the future.